Hello, my dear friends. Today we are going to discuss an important topic, that is the first dental visit of the child. When should the first dental visit occur? That is an important question with the parents of the children. Initially, it was thought that the first dental visit should be scheduled at 3 years of age. But according to Novak, it should not be later than 12 months of age. But AAPD, that is American Academy of Pediatric Dentistry, tells that within 6 months of the first tooth eruption, you have to visit the dentist. But now it is suggested that as soon as the tooth erupts into the oral cavity, you need to visit the dentist. Parents' role in preparation of the child's first dental visit. Ask the dentist about the procedure. Talk to your child that what is going to happen in the dental clinic. Bring all the child's medical records to the dental clinic. Pre-appointment modeling. There are two types of modeling of the child before the child's first dental visit. That is the audio-visual modeling and the live modeling. Audio-visual modeling, a tape with the child behaving very properly will be played on the TV monitor. On the day of the visit, the child sees this videotape and this positive videotape instills a positive behavior in the child so that the child will behave properly and calmfully in the dental clinic. Yeah, but one disadvantage is there. It requires a space, a monitor, a TV, and so on. So this procedure is a little expensive. The next model is live modeling, where the child's sibling or another child or the parent will be undergoing dental procedure calmly, obeying the dentist, and positive attitude will be instilled in the child seeing the other child which is behaving positively in the dental chair. But it is found that the siblings, mostly the elder siblings, seem to be a perfect model in live modeling technique. Recommending procedures to be carried out on the first dental visit. First dental visit is like an introductory icebreaker. Make the child very comfortable. Do not do any procedures. Slight polishing of one or two teeth is enough. You can take a radiograph telling the child that you are taking a picture of his tooth. Short appointments and morning appointments may be necessary, but if the child is uncomfortable and frightened, rescheduling of the appointment may be necessary. Recommended procedures should be taken only when the child is alert. For children under 2 years of age, they may sit on the parent's lap. It is very important to make the first appointment of the child very comfortable and enjoyable. Steps of infant examination that you need to do on the pre-appointment basis or on the day of the appointment. That is, you have to take a biographic data of the child, a family history and a social history, how the child is with the parents and other members of the family, natal history, prenatal history and postnatal history. How was the birth of the child? Was it a premature delivery? Was there any birth defect? Was the child suffering from any problems during birth? And after the delivery postnatal, was the child having any fever or any other problems? Should be asked. Developmental history. Is there developmental delay in the milestones of the child? And a medical history. Is the child having any cardiac problem, or is the child immunocompromised, asthmatic, or has the child got any convulsions, and so on. And a dental history. Has the child fallen and broken the tooth, or has the child got dental pain before, like that. So you have to take a proper dental history also. Examination procedure. There are two types of examination procedure. One is the knee to knee procedure, which you can see here, knee to knee procedure. Another one is a lap procedure, where the child lays on the lap of the dentist. Tips to prepare the child for the first dental visit. Before you go to the first dental visit, a day before, you can tell the child a story about good dental experience. Make the dental appointment early in the morning. Play dentist game in the child behaving as a dentist and treating you, so on. And any psychological or physical disabilities of the child should be discussed with your dentist, and never be afraid to talk to the dentist. Various books about dentist stories, dental games can be played with the child. Do not convey your anxiety to the child. Do not tell your harmful experience about dentistry to the child. Always instill a positive attitude in the child. If the child cries in the first dental visit, it is very, very normal, nothing to worry. Allow some time for the dentist and the child to be together, so they get a good rapport and with the dentist. And you can give a toy to the child which is favorite, which will give a toy support to the child, and child may behave well in the dental cleaning. So don't instill your fears on the child before the day of the dental appointment. To summarize, the first dental visit should always instill a positive attitude in the child, so that it will develop good oral hygiene skills and the child will want to take good care of his or her teeth. Children who have developed good oral hygiene routine will normally carry them or these routines into the adult life also. Thank you so much. I hope this session has helped you. If you want any more topics, do comment in the description below, and like, share and subscribe my channel. Thank you.